All. This is Dr. Mobeen Sayed from drbeen.com. This is our show for Europe, UK, Asia, Africa, and there are folks from the US and Canada and this hemisphere as well. So this is a show for everyone then. Welcome. And the discussion that I want to do before I go to the question and answers, I want to talk about two of the important things that I think you are already aware of. I'm just going to be on the same page with you. One of these is the cases in India, and the second one is the kind of lifting the lockdown in UK. After that, we'll get back to the questions here. So welcome, and let's just very quickly look at these two news. So this is drbeen.com, and here is the UK's lifting the lockdown. So I'll go to that in a second. Let's look at India first. So in India, there has been a sharp rise in the cases. And many of the questions that I have been receiving are on the following vein. They are of this type. Questions or comments. For example, some of the folks are worried that is it the new variants that are causing this rapid spread? The other is, are the vaccines failing? And the third one is that is it the lockdowns or other things that are not working correctly? So I think the answer to all of them, number one, vaccines are not failing. It's just that if you look at India's vaccination so far, India is only vaccinated one dose, 5% only. India is 1.38 billion people's population. So just one dose only is 5%. And completed two doses, 0.8%. So how can we then say that the vaccines are given and they do not have an effect? So that is an incorrect perception. The second piece, that somehow the variants are the reasons. Variants may have been the reasons, but this is a recent spike. So there is a reason of the variant that they can be rapid, but in addition to that, there have been some more factors as well. And I want to show you those factors with this reference as well, so that it is not just Mubin who is talking about it. So if you see here, this is dated March, somewhere over here, 2021. It is somewhere in March and 2021. So I become blind when I'm looking at these things and talking as well. So Holi, a religious festival, then religious functions like Kumbh Mela, then 5 states have elections going on. Then people actually thought, because the cases had dropped down, people thought that we are good, the pandemic is over, it is nothing, and they became a little less careful, and that also contributed to this. So all of these factors are there. I do not think that this is something to be blamed on vaccines, although India has given 60 million vaccines so far or more, but consider that their population is 1.38 billion people. 60 million is nothing. So new variants, yeah, sure, but the new variants were there before as well. Another lockdown is now, so of course, Indian government is trying to figure out that what should be the way to manage it. They've asked the states to take care of it as strictly as possible to reduce the spread. But I wanted to just make sure that we are on the same page, that it is not the vaccine's failure, number one. Number two, there has been comments as well that, hey, how about Ivermectin? Has Ivermectin failed as well? So for that, I still have to go and look into the Ivermectin's use in various states, for example, Uttar Pradesh, and then their comparison to others. We saw yesterday that from a case point of view, number of people getting sick compared to Maharashtra. In Maharashtra, the number of people getting sick was about 2.7% of the population. And then in Uttar Pradesh, it was 0.3% of the population. So if that was the result of using Ivermectin, then that is a huge difference. But the number of people dying was almost same. One in Uttar Pradesh, it was 1.48, and in Maharashtra, it was 1.7. So they were similar in that area. So that means if this is because of Ivermectin in Uttar Pradesh, lesser number of cases, then Ivermectin is really helping with catching the early disease and curing it. or fixing it or helping reduce it. So this is the discussion I wanted to do about India. So once again, here, if you see India's administration of the doses, 79 million. I just said 60, but here if you see 79 million, 5% first dose, 0.8% two doses are completed. That is nothing. Then here is the India's case load at this time. So cases had gone down here, but then as the factors I just mentioned, the cases are going up. And it is possible that variants are a factor as well because they're spreading fast, but there are other factors too. And then here is the active cases, and here are the deaths that are following that too. In the British Medical Journal, what made it painful for me to read was that here globally, India has had the third highest number of confirmed cases and deaths from COVID-19. So confirmed cases, we can always argue that, hey, this is the testing, more testing, less testing. The number of deaths is important. So cases and deaths from COVID-19 after Brazil and the US. As of 29 March, India had 12 million cases and 162,000 deaths from the disease. So that is a high number. Again, I totally understand that I'm sitting in US. We have the highest, one of the highest numbers, 500,000 or more. So, but this is the situation with India. So I hope that this makes sense. The next thing that I think we should dig in maybe tomorrow is that how about those places where ivermectin has been used. So if any of you are from India and you know that data about ivermectin specifically present somewhere in some study, please share that with me. Even if you put that in a comment and that comment disappears, these comments which have links show up in my review, and then I can look at them and have them. So this is about India. Let's continue with the second part, UK, and then I'll come back here and we'll do some question answers as well. So for UK, so if we look at UK is actually doing tremendously well. I really, really appreciate it. Look at this. Even now, the active cases just continue to go down. So here, 3,702. Compare that to 59,000 or more, 68,000 at one point. From there to 2,700. So almost 20 times lower. Beautiful. Active cases, if you can see here, they're going down as well. Deaths are going down as well. So this is a very good outcome in UK. Now, I want to talk about one thing over here as well, and that is the vaccination. If this is also because of vaccination, because if you see here in UK, 47% one dose and 8% full dose. But remember that UK had actually taken this step and were criticized for just giving one dose and giving it to as many as possible. And they said that we would have effectivity even after one dose, and that is acceptable efficacy even if it is not to 94%. The result is that they have at least one dose given to 47.3% of their population. The result of that is that there is a lot of protection from the virus. So I think that they are enjoying that protection from the virus. That decision that they did was actually a good decision. At least in the hindsight, that was a good decision. So somebody who had the foresight of doing it, kudos to them. So back here now, UK is now moving to the next step, and I kind of am a little worried as well. I'm kind of looking at it with the jittery hands to say, okay, let's make sure that this actually works out. So I am sure that they have the parameters around this to say, okay, as we start doing it, let's keep an eye on the cases and deaths to make sure that this does not affect it. So here on 12th of April, so today is 6th April, so in about 6 days, what would happen is all shops allowed to open. That is excellent. Hairdressers, beauty salons, and other close contact services can open. Excellent. Restaurants and pubs allowed to serve food and alcohol to customers sitting outdoors. Gyms and spas can reopen, zoos, theme park, libraries. So almost the country is reopening. And one thing that I really enjoyed in this decision making was that if you are one family, then you can go in a place where one person is allowed, because as a family you are at home together as well, so you are not a risk for each other. So that was a wise thing to do. Look at this. Members of the same household can take a holiday in England in self-contained accommodation. Wedding up to 15, funerals up to 30, and then wake at 15. Children will be able to attend any indoor children's activity. Care home visitor will increase to 2 per residents. So this one is a little bit of worrisome for me. But again, my hope is that care home residents are vaccinated. Then stage 3 on 17 May. So they have a number of stages here, which I'm sure that you have already read it, or you could go through this. I did not actually put these links in the description. This is the first time I forgot to do it, so my apologies. But this is the UK side. So I like this as well. I wish them well. I think this is a wise next step towards opening the society, and Godspeed and good luck to them. Same for India. I actually was really happy that such a large population and the number of cases had gone down so drastically. So it is kind of sad to see it going back up. And if you compare this peak to this one, this peak went up in a broader way, and here it is going up rapidly. So that is maybe because of the variants that it is going up rapidly, and then all the other things that we talked about. So with this, I'll stop my original points that I wanted to make, and let's now have some quick questions as well. So Margaret McInnes, good morning from all from Margaret. Margaret, welcome. Good morning to you as well. So Douglas says, thank you, Sumit, for your observation report from India. So let's see what is Sumit's observation. I'm going to scroll here. So Sumit says, ivermectin in India has not failed at all. Yes, that's what I feel as well. It is only private practitioners like us who rampantly prescribe ivermectin. Our government has not officially allowed ivermectin, so blaming ivermectin is wrong. Correct. And please realize that I'm not blaming, I'm kind of defending here that I don't think ivermectin is an issue. I don't think vaccines is an issue. I don't think the variants alone are an issue. I think this is a combination of various religious festivals, various celebrations, elections, variants, vaccines in the early phases, some states not using ivermectin, people feeling relaxed that, hey, the pandemic is gone, the case rate is down, and so on. So I think all of them became a perfect storm for this. But I think that it would go down again as people would realize that this is not a good situation. And why do I think that this would go down again as people would realize? Because they did it earlier. So look at this part of the peak. It was decline. That is people's effort. So when they would see that this is happening, they would become careful again. So I think it would be all right in a few days. Doug says, hi, Dr. Bean and Cool Beans. Hi, welcome. So Itul Khan says, I have recovered from COVID last October, then had my first dose of AstraZeneca on 22nd Feb. My second dose is due next week. I don't want to take the second dose. Is it okay to skip the second dose? So Itul, if it did not do anything, for example, when you took the first dose and you were fine, then take the second dose as well. I have an opinion that the vaccine may not be needed for someone who has had the wild infection. But if you had the infection, then you took the first dose and you're doing fine, then taking the second dose is not going to be a problem. It is a booster. You can think of it that way. Zigzag says, never got notified. So Zigzag, it is actually my mistake. Today, I went out to get my breakfast and coffee and came back a little late. So when I started the YouTube side, it took a little bit time. Normally, I start it about 10-15 minutes earlier and leave it, and it just keeps notifying as many people as possible. Today, I was late, so I think that is what happens. So my apologies. Eric, welcome. I saw your message in the coffees, Eric. Thank you very much. I love the way you narrate and articulate. It almost becomes a story worth reading and enjoying. So thank you. Let's see. And please, as a request, if you can put QQQ with your questions, it is easier for me to sift through them. Paul Borg says, question, Dr. Bean, how's your wife? She's fine. So her total experience was when she came back, on the way right outside the door, she started feeling some numbness in her tongue, and then she said gulp in her throat. But then when she came back, she became okay in about an hour or so, that her, I think, tongue recovered, but the throat gulp stayed. And that continued on for 3-4 hours. Then she became very tired. She normally does not sleep early, but yesterday she slept early. And then normally if she sleeps that early, then she wakes up early as well. And she did not wake up early until I checked on her and I said, hey, are you doing okay? So she was okay. This morning she's okay. The only complaint now she has is that her knee joints are aching. She has pains in knee joints, and they had already said that, hey, you might feel, number one, fatigued, tired, and you may have joint pains for a couple of days. So she has both of her knee joints aching. So that is a new thing that she has. Otherwise she's fine. She was actually, once I asked her, is she doing okay in the morning, she then woke up and she came down and she talked with the family members and she had her breakfast and she's fine. So thank you for asking. And the reason I explain it in this detail is for anyone who is thinking about the vaccines, they should know that this is one experience at hand. Bashir Ahmed says, question, is it okay to take low dose aspirin after taking AstraZeneca, which was 5 days back? I'm so worried about the clots that you're talking about already having anxiety attack in a young individual. You can, but please remember that this is out of 20 million. This is 30 cases in one country and 30 in another. Yes, the outcome can be that the person can die, but if at 5th day you do not have anything, then you would not. So if it makes you feel better and your health allows it and your history is correct, the best is to talk with your doctor, and then you can take aspirin. So talk with them and take aspirin. But if so far, if you're doing okay, then you're doing okay. Christopher says, case doubling rate in India, Bangladesh, and Pakistan, 10 days and becoming less, which makes sense. Which makes sense. So the thing is this, if I think about India, their cases are right now in front of us on the screen as well. If you think about it, they did go down from the first peak as well. Why? It was not that there was a miracle. People had found out ways to protect themselves. Maybe there are lockdowns, but the things were similar. If we say this, the vaccine should have made a difference. Vaccine amount 0.8% total completed vaccines, or as I showed you before, a very tiny percentage. So I think because people were wise enough to take care of them, and I really appreciate some of the states' governments who had been handing out vitamin C's and vitamin D's and ivermectins and made those little strips, which were the complete packs. I think they would do that again. And I think doctors, as Sumit was saying as well, doctors know how to manage this, and they can prescribe ivermectin-like things without the taboo as we see in other countries. So I'm not too worried. Yes, unfortunate that there are some folks who are stuck in it, and some of folks would die in this process as well. So that is a sad part. Shinji says, is it okay to take ivermectin for those taking amlodipine? So ivermectin has no reaction against the amlodipine, but to be sure, what you do is either you go to drugs.com, and over there is a drug interaction. So for example, I go here and I say, the best is to talk with your doctor first, right? So look, drug interaction. On the drugs.com, you can actually go to the drugs interaction, and here you can say, for example, ivermectin I had already chosen. Let me add another drug. Let me say amlodipine, and then say check for interaction. And I have kept my ad blocker off because when the ads are running on sites, they pin my processor and my teaching streaming becomes hindered. So ivermectin and amlodipine, for example, no interactions were found between your selected drugs. This does not necessarily mean no interaction exists. Always consult your healthcare providers, and then they talk more about it. So for anyone who is curious for the interaction, a basic preliminary data can be seen on drugs.com/interactions check. How about if I can put this here in the comments. So Maru, thank you very much for your super chat. And the question, I might have been one of the first in January last year, but I didn't know about COVID at the time. Is there a test I could use to confirm this? Yes. So the test that may or may not tell you correctly is antibody test, and now the T cell test has arrived in UK as well. And that reminds me, many folks have asked me to talk about the T cell test, and I keep forgetting. So T cells test. So T cell test has arrived in UK as well. So you can get antibody test and T cell test, and they can actually look at if the antibodies are present more than, let's say, even smaller amount. That means you were infected and have recovered. And if the T cell memory cells are present, which would react, that would also mean so. So you can do that. Anubhav says, in general, would this wave in India last for a shorter period of time, considering that this wave is spreading faster and the variants have infected much more people than we think? I think it would be shorter, just because two reasons. My first reason for confidence is that there was a behavior of the society that allowed the cases to come down. That happened. So once again, we're talking about a society of 1.38 billion people. And even then they found a behavior, may that be ivermectin's use, may that be social distancing, lockdowns, whatever that was, they had reached this point. So yes, it went up fast. And if you see this spike is going up faster than this one, that means it must have been a surprise as well. And I believe the behavior would be adjusted very soon and this would start coming down. This doesn't mean that you become, careless. The behavior has to be carefulness, and then that is how you would come down. Doctors would give ivermectins, the same packs would come back in activity, and then most of these variants are more contagious. That means they should be less lethal. I know UK had a study which showed that it is 30% more lethal or more, but I think that anything that spreads faster should be less lethal. So hopefully this would go down fast, but those who got stuck in this wave, there is a dangerous outcome as well. So just be careful. Okay, so AlexBeen says, are you concerned about the potential for long-term side effects of the vaccines? So no, here is the reason. So if we look at the vaccines, if you look at adenovirus-based vaccines, these vaccines have been in production, meaning in field, for decades. If you look at inactivated virus vaccines, these have been there for decades and decades. The only new technology is the messenger RNA-based technologies. These actually I like more than even the ones that are before, because messenger RNA-based technologies do not have adjuvants, number one. And number two, the messenger RNA goes into our cells, makes spike proteins and disappears. It is broken down by nucleases. So we are good there. And it makes spike proteins, and we are done. So it is actually more pure. Yes, immediate side effects is something that we should talk about, but I do not see why there will be long-term side effects. Yes, there are some people who are saying that it is possible that some vaccines may cause autoimmune disorders, but that still has to be proven. There is no proof for that. These are theories yet. So I'm not worried about this. And my wife had the vaccine yesterday, and I just actually got my appointment this morning. It's 2 hours from here, and it is on this Thursday. So this Thursday, I would actually not have my lectures because I have to drive 2 hours to go get the vaccine and then drive 2 hours back. So I have to get out early. But I'm going to get it. And one of the reasons was that I was trying to get a vaccine scheduled near me, and I was not able to. And some of the cool beans were had started calling me an anti-vaxxer and started just insulting other people on the channel as well. That anyways, it was not the best. And I thought I should just get it and be done. So on this Thursday, I will be going out to Sacramento, which is about 2.5 hours from here, and get it. So I'm getting it. My wife has gotten it, and so I'm not worried about it. Okay. Now, what is the next question? Jessica Milton says that, can we still get vitamin D from the sun after it comes through a window? It gets filtered out a little bit, but more importantly, it is the angle of the sun. Usually the sun's angle has to be such that it is kind of above your head. And so a more slanted angle does not help anyways. So right on your head would also not be helpful because the area it can cover is smaller, but slightly deviant from the head is the kind of angle. And then full body has to be exposed. So if it is coming in through the light window and it is not at the right angle, then that is also an effect. And window panes can cause slight change as well. It depends what is the material. Dasha G says, what is your opinion on Cuban vaccines or protein vaccines in general? I do not know about the Cuban vaccine. I have not talked about it, but Novavax is a protein or sub-protein based vaccine, and I love it. I wish Novavax was here and I would take that, but it's not here. Westfield says, do you know which vaccine you are scheduled to get? No, so that is the thing, that when we reach there, for example, when we went for my wife's appointment, they told her at that time that, hey, today we are giving Johnson & Johnson. And then, so I became a little hesitant. Then we both, of course, I didn't want to make that decision for her because if there is a risk, that is to her. So I discussed with her that here are the risks and here are the pros. It's one shot. And she then decided that she wanted to continue. So I don't know what would happen, but I can tell you this: when I go there, whatever is the vaccine, I'm going to say, yeah, sure, and move forward with it. Anubhav says, do we have any studies about the prevention of long-term COVID effects by vaccine yet, or any anecdotal evidence? The only evidence so far that I could find was yesterday that I talked about Pfizer's 6 months run. And they're saying that, hey, after 6 months, the same people who got vaccinated 6 months ago, their outcome has been great. And their efficacy of the vaccine is actually even better than what they reported in trial. The funniest thing for me was that somebody looked at that, somebody watched that video, or maybe not even watched it, but a cool bean on Twitter put a comment under that video to say, why are you so against the vaccines? And I said, I'm actually celebrating that this vaccine has done very well. So don't have data more than this, but you can extrapolate data from the traditional vaccines. For example, inactivated vaccines have been out there forever. And similarly, you can see the vaccines that have been adenovirus-based vaccines that have been out there as well. The Moderna and Pfizer, the mRNA-based vaccines are newer, so we'll see what happens with them. But I think that the data would be fine. H. Al-Ghazal says, is UK variant more problematic? My friend from Jordan says so, advised by healthcare person. It is more contagious. But yesterday we talked about Pfizer, and Pfizer was covering the UK variant very good as well. So now I do not know exactly what you mean by problematic. Do you mean more contagious, more lethal, covered by vaccines or not? But generally, I don't think so. Look at UK itself. UK has the UK variant, and they have done very well. Yes, so GM Co says UV light needed for vitamin D synthesis, early AM sun. Thank you. So more help as well. One should not get too much UVA. So Don Costella, UVA sunshine, UVA damages DNA and skin cells. Hassan says, my mom got paresthesia after getting her Sinopharm vaccine. I gave her Loprin and Regix. So hope she's doing well. Paresthesia is, for example, my wife's tongue and tingling and burning. That was paresthesia. Paresthesias can happen. Sometimes tinnitus can happen. But what I'm seeing is that with some vaccines, tinnitus is becoming long-term as well. Tinnitus is happening with COVID itself as well. And then it goes away. Most of the time it goes away. We have a cool bean who is going through this. Paul Borg says, question, perhaps Abhinav Das' question was impact of vaccine on COVID long haulers. What didn't we know about this? So here is the deal. Very good question. Many vaccine companies are saying that you have become a long hauler, possibly because the virus is still sitting out in the body. And they're saying that the vaccine would kind of boost the immune system and trigger it once again, and it can help clear that hidden virus. So that is the line from the vaccine folks. And I have heard from a few cool beans who said that, hey, I was a long hauler and then I got vaccine and I have recovered. So there is some anecdotal data as well. There is no study yet. But this is the two messages that I'm seeing. One is from the cool beans talking and commenting, and the other one is the vaccine companies. Colin says, did you get my emails from Art M. Ginty where I included a storyline? So Colin, I would actually look at that today with my support team, and I would also send you my personal email as well to continue with that. So, but I saw your comment and I have a meeting. So after this, I have another meeting. And after that meeting, I have a meeting with my support team where we'll go over these emails. So I'm sure that I'll get it. Thank you very much for this. GB says, sir, I developed venous clots with 50% sudden platelet fall after first dose of Covlshield. My antibody is positive. Should I avoid the second dose or wait? So tell me this, how are you doing? If you have been able to handle this situation, I would be, of course, not for the second dose until you talk with your doctor. You see that if after the second dose, when immune system kind of reacts a little bit harder, what should be your reaction at that or preparation at that time? So luckily, I think for AstraZeneca, as the time passes more between the two doses, its efficacy rises. So maybe you will be okay, but please make sure that you talk with your doctor. They would look at all of this and then plan with you. And these kind of messages, actually, I had one more cool bean talking about the clots, and in that vein, what Canada has done is they have put a label alteration on the Covishield, which is AstraZeneca's equivalent, to say that if you have persistent headache, shortness of breath, cold, clammy legs, or pain in leg, or abdominal pain as well, which a Kulbin was talking about yesterday, and that is persistent, then please make sure that you talk with your doctor about the clotting. And so as much as we say it is rare, here we have a case. We have a cool bean who is saying that he had it. Another cool bean was saying that yesterday. So my reason for talking about this is to make sure that doctors are aware of how to handle it. And we are aware of how to identify it. So we can talk with them and say, hey, guy, this is what happened. Art Patron Forever says, anybody find useful information about cyproheptadine value related to COVID-19? Please post in comments here. S. Sun says, thank you for your kindness and generosity in sharing your talents and time to help so many. Thank you very much. I'm very, very glad. And it is an opportunity. It is a blessing to be able to serve. When I talk with some of the cool beans, and I say it very often that if it was not me, it would be somebody else. There was a need for this. And there are so many else as well. Far better, much better than the messaging the way I do. But still, there is a blessing, there is an opportunity that I was able to serve for that, and I'm grateful for it. I was thinking last night when I was on my bed that at least when people will be counted for who was helping and who was not, at least whatever is my effort, however big or small it may be, at least I will be counted on the side of those who are trying to help. Paul Borg says, yes, Dr. Bean has addressed a couple of times, should be less, but after antibodies reduce, some transmission, COVID can occur. No studies yet in this one. Christine says, how many have had clots and never reported it or didn't know they had clots? It is possible that many may have it. How much time gap should be? Murthy says, how much time gap should be given for the intake of Ivermectin as prophylaxis and Covaxin, Covlshield Vaccine to avoid any interaction? Thank you for educating people on COVID. So I'll give you two answers. And I always give these two answers. One answer is from Dr. Hector Carvalho from Argentina. He says that he asks his patients, and he has done Ivermectin studies as well. He says he asks his patients to stop 2 weeks before the vaccine and then keep it stopped for 2 weeks after the first dose. And then after you're fully protected, then it is between you and your doctor. I have always said that because ivermectin does not interfere with vaccine's function, because of that, it is actually okay to continue taking it. So really, it is between you and your doctors, but there are both opinions that are available. Shinji Speaks says, why do I get this impression that WHO overlooks the data coming from Bird, FLCC? You're not getting the impression. That is what they're doing. They don't care for these organizations. As you must have seen with the Andrew Hill's thing as well, that on one end, it was said that the report that he created and the narration that was given were different, but he came out, Andrew Hill, and he said, I'm happy with the report. So even if the data was modified or the narrations were changed, he came out and he said, I'm fine. So when there is such medical ethics issues at such levels that we cannot even trust who is actually on what side. And unfortunately, that puts me on the same spot. That puts me in the same group. And there are cool beans, if you look at the comments, there are cool beans who say that I am lying. There are cool beans who say they trust me. So this has happened all around. But these medical leaders, WHOs and FDAs and CDCs and the people who are running them, they have not done good. I just know this much. They have not done good. They may have done good for themselves or the companies or others, but they've not done good for the people. And think about it. A doctor who looks at the data, he knows what data means and then articulates it differently because he knows that public will not get it and he can get away. For example, in the US, the total healthcare workers are about 29 million, including pharmacology and pharmacists and support. If you take healthcare workers, nurses, and doctors, they are about 10 million. Out of them, 875,000 are the doctors. Rest are nurses, nurse practitioners, physician assistants, NPs, DNPs, and so on. 5 million active. The rest may not be active, and so on. With this, they know that these 10 million people, even if they found out, so what? The remaining 300 million people, we can just cheat them. This is the dishonesty that is going on. And this is why my work, when I was thinking about it last night, my work becomes interesting for me in this way, that I have been helping us understand how to understand these things and make our own opinions. So if you go to my earlier lectures, you would see that I've talked about positive predictive values, negative predictive values. I've talked about what does p-value means. I've talked about when you're looking at a study, confidence interval means what. The reason for doing that is that then you can look at that data by yourself. And I know that you can figure this out by yourself as well. But the thing is, I got the opportunity to be part of that understanding. So you can look at that data by yourself and figure it out. I still crack up when Dr. Corey was talking about some of the ivermectin studies, and one of the cool beans said, hey, the p-value is not, it does not show significance. And I challenged the Dr. Corey back, and I said, look, cool beans are saying that the p-value is not significant. And he cracked up, and he was kind of, I'm sure that he laughed, but he was impressed as well, that the cool beans are that informed and educated. That was my point. And so when somebody tries to corner me, which a few days, some cool beans have been trying to corner me and say, just talk this much about these things and don't talk about these. The point is not that. The point is, my job is to bring in enough education that you can make your opinions. I don't want to make opinions for you. Anyways, let's see. There is a question from Vakar Ahmed says, question. So Vakar, what is the question? Doug says, is any European country doing well besides UK? That's a good question. So why not we ask that here? Guys, please comment what European countries are doing well, because I would love to see this as well. Christine says, Dr. Bean, your work is invaluable. Thank you very much. Joel, thank you very much for the super chat. How safe is Pfizer vaccine on clots, thrombocytopenia? So numbers. Out of 20-30 million vaccine doses given, there have been about 30 cases in the UK. And how many deaths? I think about 10 deaths. I may be wrong off the top of my head. Then there are similar numbers in Germany with 8 deaths. And there are a couple of numbers in Netherlands as well. So in the bigger picture, it is a very small number. The reason I keep making noise about it is that this is something that can be controlled. So if you are aware and your doctor is aware, and if you do get the signs of this, you can get help for this. So now people have been sending me comparisons and saying, hey, so let me share those comparisons as well. If these 20 million people who got AstraZeneca did not get AstraZeneca and instead got the infection, and they were all, let's say, in an advanced age, then millions of them would have died. If they were all in younger age, as AstraZeneca is doing, then about 2.5 million would have died, or I think 300,000 or so. So the point is, if the actual infection is faced, then the risk is more. But if the vaccine is faced, this specific risk can be further reduced by taking the drugs that help with the clotting. Zap RD Virus, thank you very much for your super chat. So one request to everyone here is that please, if you can keep your questions to COVID related topics. I know that there are so many other illnesses that are worth discussing as well, but I try to keep it on the COVID so that somebody who's listening can find value for COVID. That is the problem at this time that we are working on. Iram says, I wrote many times questions but no answers. Iram, what is the question? Akash says, is it true that anti-leprosy drug clofazimine is having antiviral properties? I would have to look that up. Lance Rebo says, are you worried about mRNA vaccines recapitulating the spike protein that has been found to have sequences for HIV, rabies, venom as a prion genesis site? No. So here is the important thing. These vaccines are already being researched by independent researchers. There are people, I actually shared a study a few months ago where there was an independent research unit who looked at the Moderna vaccine and talked about the mRNA in there and some of the properties of it. They cannot just hide HIV or rabies or blah in there and just say, okay, now this is out. Number one. Number two, please realize all RNAs are made up of amino acids. Amino acids are like bricks in the house. So this in my room right in front of me, there is a fireplace, and the fireplace has bricks on it. Otherwise, most of this is wooden. So those bricks are the same bricks that are everywhere. So if somebody says that, hey, Mubin's fireplace wall is made up of brick, so anything else that is also made up of brick is the same wall, it's not correct. So the HIV or rabies or venom or anything else, they also, if they are messenger RNAs, they're going to have messenger RNA units in them. They are going to have the amino acids in them. That doesn't mean that this vaccine has them. It is the particular structure of the mRNA that matters. That is very similar to if I say I can speak English and I understand the alphabets, then I can write poems like some English poet. I cannot. So these two things are separate. Robert says UK will not share vaccine AstraZeneca for European countries. That's why Europe is very angry. I don't know. Europe has been stopping and starting by themselves as well of this vaccine. So I don't think that it is UK saying we're not giving you the vaccine. I think if, for example, let's say for a second, AstraZeneca doesn't cause any big issues. Europe is, every day you hear some countries stopped it, some countries started it. Now Germany has changed their approach. Some other countries have changed their approach. So I think there is and AstraZeneca is not totally innocent here either. Their trial, their doses, their window durations, their efficacy announcements, even in the US, they also have a little bit of a gap in their communication. Simple Meerkat says, Hungary now has one of the highest COVID mortality rates in the world with more than 21,000. Oh, wow. Why? Wakar Ahmed says, I got Sinopharm vaccine second dose on 2nd March. Okay. After 20 days, IgG titers were quite high. However, got COVID infection 2 days back. PCR positive, mild symptoms. So what could be the mechanism? New variant of what or what? No. So Vakar, these vaccines are not 100% protective against getting the infection. For example, I was talking about Pfizer yesterday. Pfizer's overall efficacy is 91%. That means there are still going to be 9 people who would get the infection. The protection has to be seen also in terms of death from COVID or severe disease from COVID. So Pfizer's vaccine data yesterday showed that even after 6 months of the vaccination, there was no COVID-related death in vaccinated person. And according to the CDC or FDA's severity discussion definition, Either there was 0 people who were severe or 1 person who was severe. That is the benefit. Compare that to those who were not vaccinated, and they were having 875 people had the infection, and some of them became very, very severe as well. So it is not to look at, hey, I got a variant. It could be variant, meaning I'm not saying variants cannot do it, but I do not think that if you have the vaccine, then the variants are now able to get in and do the damage. We haven't seen such variants yet. Most of the time, the vaccine efficacy is not 100%. Then I'll give you another example. Another friend of mine who had Sinopharm, his wife became sick with the COVID, and he became sick for about 10-12 hours. And I have discussed it many times that the vaccine generated memory cells, they take anywhere from 10, 12 to 24 hours to wake up and increase in number and start production of antibodies. So for that time, virus still is able to get into the cells and cause some infection and cause some damage. To some people, it would not even feel anything. To some people, they may have mild symptoms. And now it also depends, when did you have the vaccine? Very close to the vaccine, you may have IgA in the mucous membrane, so virus may not be able to get into the cells that easily. But later on, IgA might also reduce because the cells have thought that, hey, we don't need to really produce any antibodies, let's go to sleep. And when the actual infection comes in, they would work. So to answer your question, in short, I don't think it is a variant. It can happen. The good news will be that your body would just take it as whatever and move forward. That is the benefit of the vaccine. So I have 8 more minutes. Doug Gross says, question, how is Austria? I read they were trying to get Sputnik. So let's see. Sorry. Oh, Doug, I actually looked up your name instead of Austria. There is going to be a country, Doug, with your name. Austria. So their first peak had 9,000, 5,000. If I turn on 7-day moving average, then the peak was 7,000. Now they had a peak, but that is going down. So almost 50% of the last time, but it seems like it is trending downwards. The active cases are trending downwards as well. And then the number of deaths are kind of consistent and sustained, not as bad as they were in the second spike, second peak, second wave. Lance Rebo says, if you run the sequence being expressed by the spike protein in the Moderna Pfizer into PLAAC analysis, you will find they both express the prion genesis site. Thoughts? So the thing is this, once again, as I said before, prions are the most scary and most interesting pathogens, that they are even tinier RNA pieces with nothing with them but just those pieces. So tiny RNA pieces can be seen in any RNA. So if for some reason we can see that there is a prion piece in there or prion genesis site, I can assure you that if you look at the original spike protein, you would see the same as well, because these folks are generating these RNAs from the original spike protein RNA model. The only difference could be that they may change some amino acid, not sequences, some amino acids bases to make them a little more durable. So heads up, 6 more minutes. Julian Charles says, question, is it safe from a blood thinning point of view to take NSC and aspirin and ivermectin simultaneously? So we know that ivermectin can trigger or kind of augment the function of thinners. So no, if you are actually taking these, then please be judicious. Fiona says, I love these chats, so interesting and informative. Thank you, Dr. Bean. You're very welcome. Billy Dye says, how is the Philippines? Let's see. I hope I don't type Billy's name here now. Philippines. Philippines. Oh, wow. If I go for 3-day moving average, they have a peak. It seems to go down now, but we don't know. From the peak, it doesn't. Isn't this because they stopped ivermectin, banned it? Yeah, so number of cases are not doing good. Although it seems like active cases are now going down. Let's watch it for a few more days, but it is not good. Look, compared to where they were, it went up from 1800 to 10,000. So 5 times increase in cases. Frank Crook says, is UK doing well because we dealt with the alleged aggressive UK variant? We had a lot of deaths before vax rollout. Now US and other countries now getting UK. It is possible. And it is possible that those strict lockdowns that occurred near Christmas and New Year, and the variant was spreading at that time as well, and everybody was yelling at the government that why the heck are they doing it? Maybe that lockdown helped, and then control continued, and then more vaccination occurred as well. Cool. So this is a very good question. So Gautam says, how is China doing so well? I have no idea. Are they not reporting it, or they have gotten a secret clue for how to manage it? They are doing very well. So I have a couple of minutes. I would take a short break. So MJ says, using ibuprofen and NSAID drugs, especially after having the vaccine by more than 5 days, will that affect or reduce the effectiveness of vaccine? No. So I have had this discussion before as well. Anti-inflammatory drugs, and even CDC says it. So not Mubin's opinion. You can actually go to CDC site. I shared it a few days ago, their link as well. Even CDC says that if you feel pain or you have those side effects that they're not pleasant, then take the painkillers. So as long as they're non-steroidal, they're not really going to suppress the immune system. They are going to try to reduce the inflammatory cytokines or inflammatory products, and that would not interfere with vaccine. Cool. So Christine says, Dr. Bean, is it safe to take vaccine 3 weeks postpartum and breastfeeding? So number one, congratulations to whoever had a baby, and enjoy your new family member. Secondly, I do not know, and I have always been very, very hesitant to talk about pregnancy and newborn babies. Yesterday, when we went for my wife's vaccination, there was one pregnant woman who was standing right next to us, and then we saw someone else in there as well. So, and then in Israel, they have also said that they have been administering vaccines to pregnant women. From a pure theoretical point of view, a mother sends IgA to her baby in milk. because milk is supposed to be just like our mucous membranes are wet. Milk is a wet thing as well from our body, so that also has IgA in it. So if a mother is vaccinated, she would be sending IgAs to the baby, and that would protect the baby's mouth and GIT, and that is a protective effect. So in theory, the effect of vaccinating would be protective for the baby. But please talk with your doctor and get their opinion as well. Jody Orlansky says, how do I become a patron? Thank you for your common sense and educated opinion. So thank you very much for thinking about that. What you can do is a couple of things. I'll put the patron in the description of this video as well. There are 3 links. One link is if you wanted to buy me a coffee. The other one is to become a patron. And the third one is to just, if you wanted to support this work. So you can just look at the links in the description, Jody, and thank you very much. So guys, cool beans, I am above time. I have my next meeting. They'll be waiting for me. I would see the cool beans, some of you this evening, others tomorrow morning. Thank you very much. Please like, subscribe, and share. If you like the least, then just like it. And then there are 3 links in the description. One is if you would like to buy me a coffee. The other one is if you would like to become a patron. And the third one is to support this work in general. Thank you very much. Stay safe and healthy. And I would see you tomorrow.